38,625 new COVID infections have been reported in New South Wales in the 24 hours to 8 p.m. last night, Kirsten. To put that in perspective, that's a rise of 3,631 cases on the previous reporting period. Health authorities have been saying that the state could expect a sharp rise in cases, and this certainly appears to be the case. Sadly, Kirsten, 11 deaths have been reported in the last 24 hours. That's the highest figure since early October, and health authorities have extended their deepest condolences to the families of those people. If we turn to hospitalisations, there are currently 1,738 people being treated in hospitals across the state with the virus. That's up 129 patients on the previous reporting period. And if we break down further ICU rates, that's now sitting at 134 patients, which is a rise of 3. So ICU seeming to remain stable at this point in time, Kirsten.
And Cecilia, there is a crisis meeting of New South Wales Cabinet today.
That's right. New South Wales Crisis Cabinet, now known as the state's COVID Economic Recovery Committee, is meeting this morning. The New South Wales Premier Dominic Perrottet has flagged that they may consider putting a suspension on elective surgery as the state deals with this surge in Omicron cases. Of course, that's being compounded, as we've been hearing over the previous week, about the number of healthcare staff that are currently off work due to the virus. That's expected to be discussed today. Now, the Australian Medical Association says while a suspension on elective surgery may be inevitable, they say it could have been avoided, and just because a surgery is deemed elective, it doesn't mean that it's not necessary. And they're concerned about the backlog that this will create, as well as that possibility around the suspension of elective surgery, Kirsten. There have been reports this morning that further restrictions could be reintroduced in some hospitality settings, including pubs and nightclubs, specifically around the singing and dancing and standing while drinking. On top of that, there has been some speculation that major events, there might be some changes around the rules to those. They could be suspended if deemed risky by New South Wales Health. So speculation around those further restrictions this morning, Kirsten, so it will be interesting to see what the result of this cabinet meeting will be this morning, and of course we'll keep you updated on the result of that throughout the day.